Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jessica Adams. This is one of 4 regionally focused episodes on what patients want in HIV treatment and prevention. This episode features a conversation between Deondre Moore and Dr. Samantha Hill from the United States. Deondre Moore is the U.S. Partnerships and Community Engagement Manager for Prevention Access Campaign based in Houston, Texas, and Samantha Hill is an assistant professor in the Division of Adolescent Medicine in the Department of Pediatrics at the University of Alabama at Birmingham in Birmingham, Alabama. In this episode, they'll discuss some of the barriers to genuinely patient-centered HIV care in the United States and offer calls to action for healthcare professionals for responding to patient preferences. For the full online educational program, please visit the link in the show notes for this episode. Now let's get started and hear what Deondre and Samantha have to say.
Deondre, we're here to talk today about really what patients want in their care for HIV management as well as HIV prevention. And the best way to start off is starting off with some of the things that you think might be barriers that patients are perceiving as an advocate for the community, as a member of one of the communities. So curious.
Yeah, absolutely. And just want to kick this off by saying how important this conversation is. And I'm so excited that we're here and that we have people who are going to be listening to this who are working in healthcare, who are the healthcare providers, and who are going to be able to learn so much from this information and hear from advocates or an advocate and take this back with them in their workplaces. So yeah, so there's a lot. Like there is so much that we can go through, but I think that we have a general overview that things that we can talk through today. One of the first things that I think about when the word barriers comes to mind is sort of like perception of risks, right? Which kind of goes for patients and healthcare providers. And one of the things that I think is one of the most challenging things, or has been for me when I was first diagnosed, was the language that healthcare providers was using and not necessarily understanding everything that was going on, especially for a person who is newly diagnosed with HIV or a person who may have just received an HIV negative test result, to understand what next steps are, what everything means, and what their options are. Just ensuring that healthcare providers are communicating everything from a patient level standpoint and not assuming that all patients have the same level of education or understanding as each other, or especially as our healthcare providers. That was just one of the things for me that I had to go to multiple appointments to finally get an understanding of what exactly my healthcare provider was talking through or going over. And also, again, as a newly diagnosed person, you kind of don't know how to speak up to your healthcare provider, and it can be kind of intimidating, right? Being in that space and trying to understand, or accept this new diagnosis, not knowing if you can ask questions or, not made to feel comfortable. Let me say that. I think that's one of the biggest things is ensuring that patients feel comfortable to ask questions and ensure that you're intentional to know or to notate to your patients that if there's something that they don't understand, feel free to ask as many questions as possible. There is no such thing as a stupid question. The only stupid question is the one that you don't get to ask that's on your mind. So yeah, making sure that patients feel empowered to communicate back and forth with you.
Yeah. And you hit on some great things too, that from a provider standpoint, I know it took me a minute to pick up on these skills because there's an art to it, but, definitely understanding that whenever you're even doing an HIV test or an STI test or even something else, that the person that I'm caring for, the person I'm working with, has a certain level of anxiety or other emotions that are going on. And so because they have those emotions that are going through their head about the possibility of what this test may mean and what the result may mean, me as the provider speaking, 1, in medical jargon, or 2, just trying to get everything in, that I think is really important about either HIV treatment or HIV prevention or STI prevention in that setting, it may not resonate with the person I'm working with, right? Because their mind is somewhere else, like, oh my gosh, I could have had HIV, I could have had gonorrhea chlamydia or something like that. And so, it's really important for us as providers, as healthcare providers, to recognize that, health literacy is something that fluctuates from person to person, but even a health literate person, when they're in a setting that can be stressful, or when they're anticipating or hoping that the news isn't going to be what they don't want it to be, that health literacy level goes down for everybody, including providers. And then the risk, I completely agree with you about the perception of risk. I think we approach everything like, okay, hey, so you're doing this, this, and this. You're going to get an STD, you're going to get HIV, you're going to get pregnant, you're going to get something. And for me, I have so many patients that express frustration about like, why can't I just have why can't I have sex? Why can't I have a healthy sex life? Why does it always have to be like, don't have sex because of X, Y, Z? Why can't it be a fun and pleasurable experience? And I think that is a skill that I think back to my own training. We didn't quite learn in medical school. You have to kind of learn it on your own, which is how to take a sexual history and be positive and talk about ways to have pleasure and ways to make sure that you're enjoying the experience and things like that. Because when we just turn it to like, you're at risk. I know I personally don't like hearing that I'm at risk for anything.
Right.
So
yeah. I think for me, that's another big component too for healthcare providers, is to make sure that patients feel comfortable and know that they can still, they can have healthy sexual experiences and amazing sexual experiences too. One of the things I think about is conservative communities where we have healthcare providers. And I, being someone who comes from the South and having done work across the global South, just understanding that there are some healthcare providers who have that mindset where it's like, you probably shouldn't be doing X, Y, and Z. I personally have had healthcare providers tell me, well, you know, you're HIV positive, so you really shouldn't be having sex as much anyways. And if you're going to do it, blah, 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 you know, go on and so forth. And then I had to educate my healthcare provider about certain things about being under type and what that meant, but also to let them know, like, I'm absolutely entitled to have great sex. I'm going to have sex. Like, this is, it's a human right. It's who I am. I refuse to be out here stressing and not having a good time. Whatever that looks like for me, that's my decision. But as a healthcare provider, I think one of the jobs is just to make sure that your patients understand, hey, unfortunately, there are some risks. And if these things happen, here's how we go about those. And these are the next steps that could happen. You come back here or go to your nearest clinic and so forth, but just making sure the patient has an understanding and does not feel judged for their sexual experiences or engagements.
Yeah, I love that. That's really, you know, us in the healthcare setting, putting our biases in our, whatever our preconceived notions are, or whatever it is that's uncomfortable, right? In our own personal lives. We walk into that office, that clinic, that healthcare space, those things have to be put aside because we are working with people that are more than likely different than us. You know, they may look like you, or maybe they have the same religion as you, or they have the same sexual identity, gender identity as you, but they're going to be different from us in some kind of way, right? And so we really have to put those things to the side because we are the hindrance, right? When we don't put those things aside, we are the hindrance to our clients and our patients receiving optimal, excellent, comprehensive healthcare.
Absolutely. And let me ask you, Samantha, have you seen any other specific barriers or things that, you know, were challenges for folks getting into care that you heard of, or were your patients able, or have you heard of patients being able to express those challenges to you? Because I know I have a few more that I can talk through as well.
Yeah. You know, one of the things that I think is my personal little pet peeve is really just when we don't understand that the people we serve are multidimensional and their lives are fluid and in flux. And some of them may be in a fantastic stage in their life, and some of them may not be in a fantastic stage in their life. But when we don't understand that and we establish harsh boundaries that don't account for life events, that's like my pet peeve. And so the easiest example I can give is transportation. For me, I do HIV management and HIV prevention, and on both ends of the spectrum, because those are two different clinics where I am. My clients may or may not have transportation and may have to either rely on someone else for transportation or have to rely on the clinic to get them, maybe through an Uber, or I shouldn't say, may have to rely on us to get them through transportation through the common apps that people use to get people to go places. And what I find is, you know, when you have these things is like, hey, you are not on time for your appointment. But then you talk to the patient like, yeah, I know my car broke down, or the person that was supposed to take me couldn't take me. So I had to scramble and find someone to take me at the last minute. I know I'm late, but I'm here. Yeah. When you have like, actually sitting down and listening to the patient's journey to get to clinic, there's no reason I should turn them away. Yes, I know we have to have rules and regulations so that we can see all the people that we need to see in a timely manner and, so on and so forth. But the clients and the patients that we serve in these capacities, many of them have challenges and they're doing their best to get here on time. They're not trying to, play the system or anything like that. So I think there's this balance that I know from the healthcare provider side that we struggle with, some of us, as far as understanding, like, this is the set boundary, but this is the life circumstance that happened. And the patient is now here in front of you. And can you provide care and services to them as the individual that they are?
Yeah, I think that's one of the things too, is knowing that there are healthcare providers who do understand that, and transportation being one of the biggest things. And what I've seen in the past are, and we'll talk about advocacy later, but just having healthcare providers who can advocate for better transportation or access, ensuring that their clients can get to those appointments. Yes. Because like you said, nothing is reliable these days. Things happen. We have to expect the uncertainty to always happen most of the time. And just helping our clients and going the extra mile to know that you care that they make it to those appointments can mean all the world to them. We've often seen patients get there 20, 25 minutes late, and then now they can't be seen. And I think that that's one of the most heartbreaking things, is that we don't know what this patient has missed out on, how they missed work, what could have happened. And now just because they're just a few minutes late or whatever the situation may be, they get turned away. And that's something that we have to stop. I get it. Yeah. Time management is a thing, but oftentimes the communities that we're serving, especially those living with HIV, don't always have the privilege to just be there on time because of things that are happening in their lives, but they're still making an effort regardless of how late it might be. One of the other things that I think about, again, is just ensuring that healthcare providers come from a place of cultural humility or cultural understanding. And to me, what that means is meeting the patients where they are, understanding that who shows up in your office, in your waiting rooms, and in the doctor's offices themselves might not be a person that you're used to serving. And that's okay. If you get a patient of different experiences, of trans experience or anything, or a queer person or gender non-binary person, honoring those patients as who they tell you that they are, because the slightest level of disrespect, whether intentional or not, or because you feel like, oh, this is what I see on paper and not who I see in front of me, that can be such a huge deterrent to patients wanting to come back and engaging into care. And I've seen that often. I've experienced that as well myself. It's important for healthcare providers to be intentional and ask patients certain questions. How do you identify as? What are your pronouns? And just making the patient feel welcomed and being able to show up as themselves.
Yeah. And I would add to that, once you know pronouns, names, if their name is a dead name that's on your chart, making sure that everybody that's in the office knows who this person is, how they prefer to be called or referred to, and that there's documentation somewhere in the system so that this isn't happening every single time, or it's not happening with different parts of the office team, right? Like, so the front staff doesn't know, but everybody else does, or vice versa.
Exactly.
So being really authentic, thorough, and intentional in how we make each patient feel welcome for who they are, like you're saying, is really, really key. I think one of the other things I think about, and this comes from the perspective of being on the management and the prevention side, are the idea that a lot of the people that I serve and that we all serve have a lot of different needs, right? So it's not just needing their HIV treatment medicine or their PrEP medicine, but it may be housing or substance use, mental health services, regular basic medical care. Maybe they didn't have a medical home prior to coming in for HIV treatment or HIV prevention. And so one of the things that I noticed, like in my clinic that serves individuals that are living with HIV, we have wraparound services. We have an interdisciplinary clinic space with social work and case management and psychology and all these things. But in my prevention side, and I mention this particularly because I know there are some prevention people that'll be listening to this, you may not have all those services. You may be doing prevention as a primary care person. And so it's just you and your passion to serve a specific population. And so I say all that to say that as healthcare providers, no matter what your actual task is, it's our job to really be aware of the resources in our communities. And so maybe I don't have access to a social worker who can help me find housing or things like that. But I should know either how to page the on-call social worker or what programs are available in my community that have 24-hour housing or emergency housing, emergency food boxes, all those kind of things. I should know how to link my patient up to medical care so they can get the rest of the services if I don't provide them in the clinic that I'm serving. And so you had mentioned earlier advocacy and particularly providers advocating for transportation and being understanding of transportation challenges that patients may encounter. And I think this is another way that healthcare teams and providers can be advocates. It's really knowing the resources that are available and having them somewhere so that when someone comes in that they need something, you're able to offer them resources, even if you don't have the specific discipline or person that usually does that.
Yep. Agreed. And just knowing that there are healthcare providers who will help and act on behalf of the patients to get them more resources, to show up and be them whole selves, or ensure that healthcare providers are aware of resources for their patients is another thing as well, because sometimes patients don't always have the time to meet with everybody, right? So patients might not be able to go in there, but to know that a healthcare provider has somewhat of a basic level of understanding of resources out there for their patients to get access to can mean all the world, because then you can connect them later with someone, and also giving them the opportunity or the options to meet with case managers or anyone else, maybe after their appointment through another way. It can be virtual. They've seen you in person. They can have the option to meet with or have a phone conversation, a virtual conversation with case managers so that they can still get access to their resources that are made available to them as well. And knowing that that's an option makes all the difference in the world, because just because they cannot meet them in that moment or that day in person doesn't mean that they should be deterred away or that they should be denied any of the resources that they have a right to.
I love that. And we have to be innovative. We should be providing comprehensive care in all of these settings, but for various reasons, one of which I'm about to mention, I think you and I, who both practice in the southern part of the country, experience this. But everybody needs these resources, and we have to be innovative. And so again, what popped into my head was the issue with insurance. And you and I particularly live in areas or states, I should say, where Medicaid hasn't been expanded. And so what does that look like? We may be able to provide someone HIV treatment or HIV prevention as far as the medicines, and particularly for HIV treatment, you can get more things for your care. But what does it look like when you don't have access to insurance because you fall within that window of either not being able to afford private insurance or not being eligible for our public forms of insurance? And how does that affect all the other services, your primary care, your dental care, your mental health care, your substance use care, your gender affirming care, all those things? How does that impact those services when you are only getting one thing, being either HIV treatment or your PrEP?
Yep. Agreed.
Yeah. So I say that as a healthcare provider, as far as innovation, we have to be innovative in those manners too. And it goes back to knowing your resources. Are there areas or organizations that can provide some of these other services on a sliding fee scale or for free, so that all of our patients can have comprehensive care?
Correct. Agreed.
Yeah. What other barriers can you think of, Deondre? I feel like we're going through a lot.
No, yeah, I mean, we have, I'm trying to think. I mean, of course, housing. I think housing, seeing that next to transportation is probably one of the biggest barriers, if not, the biggest barriers. The lack of housing can be such a huge deterrent as it relates to getting access to healthcare. And what I've seen is, what I hear is that, how can I worry or focus on getting my medication if I'm newly diagnosed, or reaching undetectable viral loads and so forth, when I don't even have a roof over my head? Like, getting access to medication and coming to a doctor's appointment is probably the last thing on my mind. So that's why it's important to ensure to learn everything you can about your patient, their living situations. Do they have stable housing? Are they homeless? Are they living with other people? Are they couch surfing? What are their situations? And ensuring that we provide them with the best resources possible so that they can have a form or sense of stability around them. But yeah, housing is such a huge deterrent these days, and I see a lot across the South that food scarcity and that's one of the big things that I've seen at least.
Yeah, yeah. I think one of the other barriers I can think of, and it's more on the prevention side than the treatment side, because I've noticed the treatment side is doing a better job of when they're doing advertising for medications and programs of having a variety of different demographics. So men, women, variety of races and ethnicities, a variety of genders and sexual identities and things like that. But on the prevention side, I think we're still falling short of doing that. And I say that because it's hard to realize that you may benefit from, in this case, PrEP is what I'm talking about when I talk about the prevention side. It's hard to realize that you may benefit from PrEP when you don't, like we said at the beginning, when you don't recognize that you may be able to benefit because of either how the provider's talking to you, right? Or your own perception of what you're doing, but also when you don't see yourself in these commercials that are on TV or in these discussions. And I say that particularly as someone that serves a lot of young people and a lot of particularly younger Black women, and both of those groups, whether it's just the age alone or being particularly a cisgendered Black woman, they really don't. I've had people tell me they didn't know PrEP was around. They thought it came out like last year. As far as all the different forms that we have, they thought the first time it came out was like last year. And it's because they don't see themselves in the commercials. And so they overlook those things. And so I think I say that to say, again, when we think about risk and we think about how we advertise for things and discuss things, it's really starting out being inclusive, because right now on the prevention side, we're playing catch up, and that's not helpful for anybody.
Absolutely agree. Cool. So one of the other things that I think that we talk about, and we mentioned this a little bit earlier, walking through, was making patients feel that they're heard and that you're actively listening to them, which also makes them feel comfortable that they're not just talking to a brick wall and things like that. So, what are like some best practices that you've had when dealing with patients and making sure that they feel heard or that they feel comfortable?
Yeah, I think for me, it's really, in my experience, it's really finding ways to get them engaged. And that's not only engaged in their own care, but engaged in the actual clinical practice. And so when I think about getting them engaged in their own care, it really does mean that I, as the provider, am listening. Like, I'm listening. I'm not trying to prepare my next set of statements, but I'm listening. And if I need to pivot because what the person I'm speaking to is talking about is different than what I thought it would be, then I pivot and we so that we're on the same page and that we're talking about the same things and what's a priority to them. And so that active listening is super important. But there are other ways to active listen as well, to make sure that maybe I do have, as you mentioned earlier, there are some patients that may not feel comfortable, especially early on, speaking up. So there are other ways to make sure that I can hear the voices of the individuals I serve. And those are things such as like having advisory boards, community advisory boards, and doing quality improvement projects. But also, I'm going to say this, it's really finding ways to for patients that are really engaged and are advocates. And I have a lot of young people that say they want to be an advocate in this area, finding ways and helping them on the path to actually get to become a member of the clinic, as far as like a part of the staff or the team or the faculty. And I know it sounds like all those things are like not necessarily related, but they are. That's part of making sure that the people that we're seeing feel seen, right? When I walk into a clinic space, for me, and I happen to be Black cisgendered woman, and I see someone that looks like me, I feel seen. It doesn't mean that we might not be on the same page. We might have very differing views, but initially I feel seen. And I think doing those things, active listening, doing having like advisory boards, and then finding ways to help individuals become part of the clinical staff are really key.
Yeah, that's one of the biggest things I think is making patients heard, know that they are heard, and know that what they're saying is being valued and being applied. I know that we've talked about this before, but understanding patients' experiences and making them feel empowered enough to share their full authentic experience from the time they got to that clinic or to that space, from the waiting room, all of that, because all of those things matter, and ensuring that the patient has an opportunity to provide feedback, whether it's positive, if something is going really great, cool, or if there's some changes that can be altered or helped, because it can help the next person ensure that they have a better experience. It's always needed there. And so just having those conversations and positive focused conversations with them about their experiences. And then also having those conversations with them and positive conversations around sex. We talked about this earlier. Just making the patients feel comfortable enough to share whatever their experiences are with the healthcare providers. I know me personally, I might overshare, as one would say. I talk to my healthcare provider about everything, every experience that I dealt with between the last time they saw me and this new time. And I can sometimes tell the expressions on my healthcare provider's face, like, oh, maybe I didn't need to know that. I don't know. So I'm going to tell it all to you so you can help me out. So I can know if there's anything I need to change. Do we need to check something? Understanding who your patients are and knowing, what potential quote unquote risks they might be facing when they're engaging in certain acts, and just providing them with the best resources possible. Just being open and honest with them.
Yeah, I love that, Deondre. The reason I giggle is because I tend to have a lot of individuals that I serve that are very similar to you. And I'll say from the healthcare provider's perspective, the easiest way to get used to being in a room when someone's oversharing is really just to, make sure you're aware of your own biases and things like that. And also do that cultural humility training and culturally responsive training that you had mentioned earlier, Deondre. And not only just do it to check the box, but do it in workshops and things where you're actually having to practice it, right? Because that's how you're able to sit into the room. Because I'm just like having a conversation. That's most of the visits that I do with my patients. We're literally just having a conversation, even more relaxed than this one, Deondre. And that took time for me to be able to do that because I was like, okay, this is okay. I don't have to be all extra medical jargon focused or even medical focused. I can get what I need to help my patient, like you said, make some decisions or continue doing things they're already doing well just by listening to them tell their story. And so I think that's key. And so like I said, we need a lot of training around cultural humility. And it needs to be ongoing and continuous. And it needs to be in ways that we can actually practice and develop skills in it, as opposed to just kind of learning the lingo. We need to understand our own implicit biases. And I know I keep saying that, but that's really the key to medicine, is really knowing your own biases so that when you see them creeping up into the conversation, you're like, oh, that's Samantha. That's not Dr. Hill. Let me turn that off. And then, I always tell the residents and the students that rotate with me, I'm like, you're the only thing I want you to get out of this rotation. Yeah, you're gonna get the medicine out, but the one thing I want you to get out of this rotation is that these individuals that we serve are just like you. They're living just like you. They're experiencing some of the same situations you experience. Some of them might be different than you, but they're literally just like you. And so if you walk into the room with that perception, and that the biggest difference might be that the names of the drugs, all the drugs or something like that. You realize that they're like you and they become your family. They don't have to. I'm not saying that every patient's become your family, but you start to treat them in a different way if you weren't already treating them in a more positive way to begin with, because you recognize it's just a person. This is just a person.
Yeah, exactly. Treating folks like patient, like treating your patients like persons or like people as opposed to just an actual patient, making them feel as if they're part of, the family. They're supposed to be there and they're just a regular person that you can engage with. It makes all the difference. Don't make them just, something you check off the box. Don't just go through your charts. Sit there, make eye contact, making them know that they, are being heard and that everything they're saying, again, as we said before, is very valuable.
And I would even add, the more diverse your staff is, you'll learn these things. All of us learn these things when we get staff in that may be from a different place or may have a different value or belief system or something else, right? Hopefully you're making the staff, we're all making staff feel inclusive. And so they should, if they're feeling included, then they'd be like, hey, Samantha, Dr. Hill, that comment wasn't cool. Let me tell you why, that kind of thing. And that's how you learn and grow, and then in turn do better with patients and are able to hear and make the patients feel heard and comfortable, as you mentioned earlier.
And also maybe even giving some patients, because there are going to be some patients who won't feel as empowered to give feedback right away. Maybe giving them some sort of anonymous way to, or some type of link that will go to them after their appointments to provide feedback as well. Because not every patient is going to feel comfortable doing that in that way or right then and there, especially if you already made them feel uncomfortable, right?
Yeah.
You as a patient, you made me feel uncomfortable already. I'm not sure that I'm feeling safe enough to provide you with the feedback that you might be requesting in this moment. And so, yeah, having that understanding and giving them the opportunity and reminding them that they are one of the stakeholders in this facility. You know, they matter, one, not only because of their dollars or the dollars from them or going to this clinic or to you as a healthcare provider, but also because they're the ones that you're serving. And then I think that we have to lead with that word is healthcare providers, clinical personnel. You're serving the patients who are coming in there. And so making sure that patients feel that, understand, and know that as well is a big part of all of this. And it also goes back to just healthcare providers being able to openly ask about sexual and other histories that the patient might be engaging in or have engaged with, because that makes the person show up holistically as an entire person, regardless of age or sexual orientation, any of that, making them know and feel comfortable having those conversations. And if it does feel uncomfortable, realizing that won't change. It won't make you more comfortable until you start engaging and having those conversations.
Yeah, yeah, I love that. That's perfect. And actually, there's two words that you mentioned that like prompt me on something else. You mentioned reminding us that the patients are also stakeholders in this clinic, and then showing up. And so, that makes me think about how we as providers have to maybe shift how we see our clinical practice, right? So, yes, the patients should be seen as stakeholders. And in addition to us, serving them in clinic, as you mentioned, how can we better serve them? And that really comes through advocacy. We need to show up for our patients. We need to find ways. And I know that can be challenging, right? Because all of us, have, including patients, have so many things that are in our lives. But as providers, particularly providers in the field of HIV, everything, and wellness, we really have to find creative ways to show up and be advocates for the populations that we're serving, so that we can move things along, and so that the patients themselves are not always the ones having to pick up the megaphone and say something.
Correct. Correct.
So advocacy days. I mean, this is a call for my providers to join us in advocacy days. Talking to legislators, maybe it's even talking to your clinic or your hospital or whoever you work for about different policies that need to be in effect. Even thinking through when you see like a new proposed procedure or protocol being put into place. An example I'll use is something that says you have to be here within 15 minutes of your appointment. Otherwise, there's no exceptions, no ifs, ands, or buts. Making sure that you have a say in that protocol and be like, actually, that's a little harsh. Yes, we can put that as 15 minutes as the standard, but we have to understand there may be extenuating circumstances, and we have to have an actual procedure to kind of figure out those things. Was the patient late because something happened that was out of their control and they still showed up as close to time as they could? Those kind of things. And so, yeah, advocacy is near and dear to my heart, but I'm saying that to you who are the real advocates. So,
Correct. I mean, that's one of the things that I love most is knowing that, when we show up as advocates and we have those big advocacy days, to look over and see that our healthcare providers, or that there are some healthcare providers there with us, it means all the world, because then we know and we feel safer knowing that there are people who serve us in clinical settings also out here fighting on our behalf, because not every person living with HIV or not every person affected by HIV is going to be able to show up to those days. But knowing that your healthcare provider takes part in some way, whether it's calling their senators or their state representatives or their local municipal personnel to be there and to advocate for more resources, means all the world, because it lets us know and reminds us that our healthcare providers actually do care about us as people and not just as patients who are putting dollars in their pockets.
Yeah. That's So well said. So well said. And, if I had to say like a summary of all the stuff we talked about, I think between you and I, everything we talked about was really from individual to macro level ways that we can all work together to really improve outcomes in this particular area. It's all about listening to what the people we're serving want, because it's hard to provide them with care if we're providing them with care that's in direct contrast to what they need, what they desire, what they're asking us for. And so I think this is a cool conversation. Hopefully it gets other people kind of started thinking in their own settings about how to make some shifts and how to continually work towards improving the clinical spaces in which we provide care.
Yeah, bravo. I'm with you. I agree. This is it. That's it. I mean, ensuring that everybody's there and we all show up together as one, fighting for the same common goal, which for me is to ensure that everybody has quality healthcare, quality access, and that those social determinants or barriers are continuously decreased and removed, ultimately to work towards an end to this epidemic once and for all.
Yeah, I love it. I love
it. It takes us working together hand in hand, just like this, a healthcare provider, the advocate, the person living with lived experiences and so forth, to continue having these conversations just outside of this setting. But again, these are kind of how the conversation should also flow between a healthcare provider and the patient as well.
Love it. I love it.
And I think that that's all that I have now. And I just want to say I'm really appreciative to have shared space with you, Samantha. This has been a great conversation. And I'm looking forward to continuously engaging and hopefully future conversations as well on more in-depth topics, because we could talk all day through all of these specific topics, from advocacy to the barriers to care, to engagement, to sex positivity and so forth. But yeah, I'm really appreciative to have shared space with you today.
You are amazing. And I echo those sentiments towards you. You are one of the reasons I got into this field to begin with. And to see, I know we're different in age, but not necessarily that much different in age. But to see the amazing person that you are and what you're doing for your communities, that's why I do what I do, to be able to put more of you guys out and in the limelight on the pedestal. And so thank you so much for sharing your wisdom. And hopefully on our end as healthcare providers, we are listening and can start doing some of the stuff that you are advocating for us to do.
Absolutely. Absolutely.
Thank you very much to Deondre and Samantha, and thank you to our listeners for joining in. Please be sure to check back regularly for more episodes on important infectious disease topics, including more regionally focused episodes on what patients want in HIV treatment and prevention. Thank you, and have a great day.